Hello everyone, and welcome to our virtual educational program. In this module, we will be looking through the evidence on which therapeutic exercises are best to improve walking after a brain injury or stroke. Walking is a complex motor skill that involves the coordinated effort of various muscles and skills within the body. The primary muscles engaged during walking are located in the lower extremities, including the quadriceps in the front of the thighs, hamstrings at the back of the thighs, and the calf muscles. These muscles work together to propel the body forward, bend and straighten the knees, and stabilize the ankles during each step. Additionally, the gluteal muscles in the buttocks play a crucial role in providing stability and power during the walking gait. Beyond muscle strength, walking also relies on balance and coordination, which involve intricate communication between the brain, nerves, and muscles. Skills like proprioception, which is awareness of body position in space, weight shifting, and rhythmic movements are essential for maintaining stability and a smooth walking pattern. A stroke or brain injury can produce various physical and functional challenges, leading to a negative impact on walking. When a brain injury or stroke occurs, it often damages certain regions of the brain responsible for coordinating movement and balance. This damage can result in muscle weakness or paralysis, particularly on one side of the body. As a consequence, the muscles required for walking, such as the ones mentioned previously, may be weakened or unable to function properly, leading to difficulty in bearing weight and propelling the body forward, such as during walking. Additionally, a brain injury or stroke can disrupt the communication between the brain and the muscles, causing coordination issues and an unsteady gait. Many brain injury and stroke survivors experience changes in proprioception and balance, making it harder to maintain an upright posture and increasing the risk of falls. Although most brain injury survivors learn to walk independently by 6 months post-injury, gait abnormalities persist through all stages of recovery. These long-lasting physical impairments can significantly reduce a person's independence, mobility, and overall quality of life. For these reasons, in this presentation we will look through the evidence and find which exercises are best to improve walking skills among stroke and brain injury survivors. Before diving into the different types of exercises that can be performed to improve walking among individuals with a stroke or brain injury, noteworthy studies have published high-quality evidence supporting that home-based prescribed exercises are as effective as exercises one would perform in a clinical setting in improving walking speed and balance after a stroke or brain injury. So, even though the guidance of a rehabilitation therapist is essential during stroke recovery, practicing exercises at home is highly effective and recommended for all survivors of stroke and brain injury. In this video, we aim to provide some resources and inspiration for exercises you can perform at home. Please note, always prioritize safety when performing these exercises. Listen to your body. Use proper form and seek guidance from a qualified professional to prevent injury. When performing these exercises for the first time, please make sure your environment is safe, that you have a stabilizing object near you, such as a wall, cane, or table, or a loved one. So what are the different types of exercises that have been proven to be effective in improving walking? First, some research suggests the use of strength training to improve walking ability. Studies show that muscle strengthening training of the knee flexors and extensors is effective in improving speed in people with a stroke or brain injury. Additionally, as leg muscle strength and walking speed are highly correlated, strength training of the legs is a fundamental aspect of stroke and brain injury recovery. For a complete program on knee strengthening exercise, please view our additional resources with a link to the Massachusetts General Hospital Strength Training for the Knee Guide. Second, the dual task concept can be used to improve walking ability. Dual task exercise training is when two activities are performed at the same time. In most cases, a motor skill, for example walking, is combined with a cognitive activity. A study conducted in 2007 looked into the effectiveness of a dual task exercise program, which included walking while manipulating objects concurrently. In this study, individuals with a stroke participate in 30 minutes of a ball exercise program 3 times a week for 4 weeks. This program consisted in walking while manipulating 1 or 2 balls, such as a basketball. Examples of exercises included walking to match the rhythm of bouncing one ball with one hand or both hands, walking while holding one ball on one hand and concurrently bouncing another ball with the other hand, and walking while kicking a basketball. Participants in this study demonstrated improvements in walking ability, as well as speed. Other ways to include dual task training into your daily life include walking while talking. For example, recite the alphabet backwards, count by multiples. Carrying an empty cup or one filled with water. Tossing a ball from one hand to another. Working on hand strength with therapy putty or a stress ball. Listening to an audiobook or a podcast. Third, water-based exercises can be used to improve walking speed, balance, and strength after a stroke or brain injury. Water-based exercises are defined as a therapy program which uses the properties of water to improve function, ideally in a purpose-built and suitably heated hydrotherapy pool. Studies demonstrated that water-based exercises may improve walking speed and balance, and that they may be more effective than land-based exercises or conventional rehabilitation. Spalding Rehabilitation offers aquatic therapy for stroke and brain injury survivors. Please scan this QR or view our additional resources for a link to their page. If you have access to a swimming pool, consider practicing some of these exercises. Water walking or jogging, which can be done forward, backward, and sideways. Forward and side lunges. One-leg stand. Hip kickers. Pool planks. Deep water bicycle. Arm raises. Push-ups. Standing knee lift. For a more detailed description on how to properly perform these exercises, please view our additional resources. Fourth, motor imagery training may also help improve walking ability. Motor imagery training can be defined as the process of imagining and rehearsing the performance of a skill with no related overt actions. This mental practice can be implemented at all stages of rehabilitation and recovery in order to train motor preparation and thus facilitate physical recovery. A study conducted in 2015 found that motor imagery, in combination with physical practice, is more beneficial than physical practice alone. In fact, they found clear evidence supporting the additional benefit of mental practice in gait rehabilitation after a stroke, with the most positive effect on walking speed. So how can your loved one practice motor imagery at home? First, there are 2 distinct types of motor imagery. Kinesthetic motor imagery involves imagining the feeling associated with performing a movement, whereas visual motor imagery entails imagining the movement itself. A session of motor imagery training to improve walking may include the following: 5 minutes of listening to a tape recording of relaxation techniques. Then, you may follow with 20 minutes of motor imagery. For example, in week 1, the training involves using computer images and movies to analyze steps and sequences required to successfully complete a task. You may find videos of people walking on YouTube. In week 2, your loved one is trained to identify problems they are having with the tasks and correct them using mental imagery. In the 3rd week, they practice the corrected tasks mentally, as well as perform the actual tasks. The session may conclude with time given to the individual to refocus on the room around them. Lastly, task-specific training is helpful to improve walking ability. Task-specific training for walking is an effective approach to help individuals with walking impairments particularly those who have experienced strokes or brain injuries. This specialized therapy focuses on practicing specific tasks directly related to walking to improve gait patterns and functional mobility. For example, specific tasks may include stepping, seated marching, knee extensions, heel raises, weight shifting, and balance exercises such as flamingo stands. By repetitively performing activities that mimic real-life situations, the brain is encouraged to rewire neural pathways, promoting motor relearning and facilitating the recovery of walking abilities. Task-specific training not only enhances walking skills, but also boosts confidence and independence in daily activities, enabling individuals to regain control over their movements and reintegrate into their daily lives with newfound mobility and self-assurance. In conclusion, there are several approaches and exercises that your loved one can incorporate in their daily life to improve their walking skills. It is important to take into consideration your loved one's preferences, their abilities, and their environment when choosing the approach that suits them best. Thank you for your attention during this presentation. We hope the information provided was helpful to you.